Hi, this is Reed Jacobs with Faith and Hope Hospice with another COVID conversation. Today we're meeting with Dr. Ann Callahan to talk about spirituality and COVID-19. Dr. Callahan, welcome. Appreciate you being here. Could you introduce yourself and tell us a little bit about yourself and the work you do?
Sure, Reed. Thank you for inviting me to this interview. I'm Ann Callahan, and I'm an associate professor at Eastern Kentucky University and also the program director of our MSW program there. For, nearly 20 years, I have been focusing in on spirituality, hospice, and palliative care, and I'm moving into research regarding long-term care. And spiritual issues has been an important component of my daily life and work as a professional and on a personal basis. Volunteer work that I do is related to that as well. So it's very much a passion of mine. So I appreciate the opportunity to talk more about this.
So I think one of the first questions I have for you is, um, I've heard a lot of people talk about spiritual well-being. Could you tell us kind of what spiritual well-being is?
Spiritual well-being is really, that is a huge
Hmm.
construct. I mean, there's lots of dimensions of spiritual well-being. Um, Spiritual well-being is really relative to the person. But very simply stated, spiritual well-being, at least for me, stems from having your spiritual needs met.
Hmm.
So you have spiritual needs for a community connection, um, spiritual needs for a sense of purpose, spiritual need for meaningful work. Uh, and you are not able to get those spiritual needs met, it can lead to risk for spiritual suffering.
Hmm. Okay. And how would you say COVID-19 is impacting spiritual well-being?
Again, it depends on what informs your spiritual well-being. So a lot of the work that I focus on has to do with the idea of meaningful relationships as informing spiritual well-being, and uh, the experience of meaningful relationships essentially with loved ones, with a vocation, meaningful relationships with a larger community. For some folks, that could be a religious community. It could be AA group, Alcoholics Anonymous group. It could be any, it could be working out in nature, walking on trails. So those types of relationships that add meaning to life um, can be compromised when we're dealing with a risk of an illness like COVID-19. Reeling back meaningful activities, those types of relationships that help us add structure to the day can really compromise our sense of spiritual well-being. We have to find alternatives. Otherwise, it can lead to distress.
Hmm. Okay.
And we're seeing that now, just in terms of a distress in terms of mental health issues, anxiety, depression, um, and that's on the negative side. I mean, I've seen lots of positive responses as well. People
Hmm.
find new ways to reach out and get those spiritual needs met for that community connection. So a lot of the work that I'm writing about has to do with relationships and how central relationships are to our sense of spiritual well-being and that need for those relationships to keep us going. And so obviously COVID puts those at risk. Relationships with our loved ones who maybe, sometimes a lot of time together isn't necessarily good for a relationship. Tension,
Yeah.
stress. Um, but sometimes it can be wonderful. I mean, it could be opportunities to finally have time together that you didn't have because you were so busy. So a lot of it is just depends on the quality of relationships you have at your fingertips and new ones that you cultivate during this time. It could be
Mhm.
new opportunities through virtual technology, renewed commitment to spending quality time with your spouse or your kids. So it could be a fantastic time for um, the cultivation of your spiritual well-being.
Yeah, definitely. That's a good perspective on it. It's not just negative, bad things happening from COVID, but it's possible to make um, some growth from it and maybe improve relationships, like you were saying, and connection that you may not have had before.
Hmm. Absolutely.
How is religion, faith, spirituality being used to cope with or make sense of the changes from COVID?
I mean, for some folks, I mean, religion is integral to coping with stress, daily stress. I mean, it could be any kind of stress, but during a period of time where there's a crisis like COVID-19, faith, religion, spirituality, absolutely, it's essential for some folks to cope with stress. We
Hmm.
draw from faith, spirituality, religion to understand, make sense out of why things are happening. Um, and some things can't really be explained, so other than it's just for some folks it could be just relying on God's will. It'll work out, it'll just really surrendering
Mm.
and prayer and hopefulness and just that reliance on a divine entity to protect you regardless, to ensure that um, you'll be kept safe. You'll be able to be okay
Hmm.
despite challenges of COVID. So I mean, everyone has their own way of understanding based on their faith beliefs, traditions are so different, um, and it's just such a huge question. It's like the meaning of life,
Yeah.
you know. But I mean, but religious rituals, other ways of coping, drawing from spirituality and meditation, different ways of coping spiritually, um, religious rituals, traditions, all those things provide means of coping. Uh,
Hmm.
the practice of those different spiritual disciplines, if you will,
Hmm.
provides you that sense of stability. Again, I'm generalizing. I don't. Everyone has their own experience, but um, in terms of the strength of spiritual coping, absolutely the literature is out there. There is abundant literature that demonstrates the therapeutic benefits of meditation
Hmm.
physiologically.
Yeah.
There's literature out there in terms of looking at medical research and even research that talks about intercessory prayer. I mean, it's just
Hmm.
amazing some of the literature out there that substantiates the power of some of these practices. Obviously it's relative to your belief system and your faith in the use of those practices.
Yeah.
I would think that would have something to do with the efficacy as a means of coping.
Hmm.
But again, a lot of the work that I've been focusing in on has to do with how relationships and drawing from those relationships, those connections that we gain through spending time alone in prayer, spending time alone meditating, um, going out and spending time with folks that you love in community, like family members, perhaps virtually connecting with folks in a community, perhaps a community of faith, um, getting out in nature, um, walking on a trail, riding your bicycle. I mean, different
Hmm.
ways of, again, I'm talking broadly, relative to your physical capacity
Yeah.
and your needs. But all those are examples. Reading inspirational literature, painting. I mean, so there's lots of different ways that we can express ourselves and gain a sense of solace
Hmm.
in the midst of the crisis of COVID-19.
Okay. Yeah, it's spirituality, huge topic. And there's um and so many different religions and faith and practices, but it sounds like drawing on um, a person drawing on their faith and what's um, taught for them as ways of coping and connecting with the spiritual, with connecting with God and connecting with others. It sounds like are kind of the core pieces.
Yeah, well, I mean, a lot of the definitions that just in the research that I've done, a lot of the definitions of spirituality are rooted in the idea of a connection, a deep,
Mm,
connection, a meaningful connection. And so we have connections. I mean, life is full of connections. I mean, that's living life is part of connecting.
yeah.
Through the day, we connect with different things physically, emotionally, spiritually, and all that relates to
Hmm.
what we draw from to have a meaningful life. So those connections to me is essential. That's what is central to the experience of spirituality. And that's why my work so much focuses on relational spirituality, the meaningfulness of relationships and how those relationships that we cultivate keep us going and
Hmm.
build that resilience that we need to face challenges like COVID-19. And so, we're talking about the expression of faith for some folks, that's just um, a religious experience. Um, but for other folks, that's simply just sitting and breathing deeply, and
Mm.
it provides a means of self-care. It's not necessarily a formal theological belief system. It's more of a, I just need to make it through this anxiety attack, and I'm gonna sit down, do some deep breathing because I'm really stressed out right now, and all this other stuff going on doesn't help.
Yeah.
So coping, for some, it's what you would call spiritual coping. It's a means through which you deal with stress.
Hmm.
And for others, it's a method of worship. It's practice, rituals, rites that we practice that sanctify daily life and big life events
Mm-hmm.
like funerals. But
Um,
it's wonderful because you have lots of resources to help us too, and
yeah.
just the numbers of virtual groups going on. And I know we're going to talk a little bit about that here um, in a bit more, as it relates to faith groups as one example. But
Hmm.
lots of great opportunities out there for for virtual resources to help. Again, I did a quick search, but I found some fantastic stuff, and I would love to share that some of these with you if you don't mind. I don't
Yeah,
know
definitely.
if maybe you want to follow up, but these are just some really good resources that put out by Serious Conversations, specific phrases and word choices that can be helpful when dealing with
Okay.
COVID-19. Vital Talk provides the communication playbook. Conversation Project provides being prepared in the time of COVID-19, 3 things you can do now. National Health and Palliative Care Organization provides COVID-19 shared decision-making tool. The Center for Disease Control provides CERC in an infectious disease outbreak, which is like emergency response communication. And Adrian Labs provides a conversation guide for long-term care and COVID-19 response toolkit. So those are really just basic points that are offered out there for folks freely to access and download and review.
Yeah, that's a lot of really good information. I'll make sure to list those resources on our website where people can find those links too. So I also want to ask you about self-care. Can you tell us more about that and why it's important?
Self-care is essential, and I am thrilled that with COVID-19 there seems to be an increased awareness of the importance of, well, the challenges that healthcare and related professionals have in being fully present day after day
Hmm.
with clients and
Yeah.
patients and families. Thankfully, it seems like there's just an increased awareness of the need for self-care resources, and just a genuine appreciation for people that engage in this type of work. So I'm so thankful. I know we talked some about some of the, I mean, if you can't say benefits, but some of the positives that can come out of this. I
Hmm.
definitely think that's one of them, is the appreciation for folks that engage in this type of work, and just a recommitment, hopefully recommitment on a professional level for ourselves
Hmm.
to self-care, and knowing that we can only help people insofar as we're able to be caring for our own selves and being able to be fully, you know, we have to have a full tank to be
Yeah.
able to share with others, and that's okay.
Yeah. And as we're talking, I keep thinking about Viktor Frankl and meaning making. Uh, and yeah, it's hard to say a positive coming from something as bad as COVID, but we're able to provide the meaning and saying, highlight, okay, yes, self-care is a thing, and we really do need to be taking care of it. It's prompting us to find new ways to connect in some of these. So even through the midst of something bad, we can find meaning in and grow from it and hopefully make improvements.
Absolutely. Yeah. The whole idea of post-traumatic growth. I mean, it's like,
Yeah.
it's not even post, hopefully growth in the middle of it. So, I mean,
Yes.
absolutely. So,
One of the things that I wanted to ask you about um, is traditions around death, rituals, either funerals or last rites, things that occur before and after a death. I know those are being seriously impacted by COVID.
yeah, they sure are. And so, in terms of religious traditions, there's a lot of um, religious bodies that have come out with statements. Um, as individual entities have
Hmm.
responded to this, how they're responding to COVID, and guidelines that have been provided by the CDC on how communities of faith can gather together in a safe way, and just basically providing like even a checklist to protect the health of their staff folks,
Mm.
staff congregation members. So there are lots of resources in that regard too, specific to the religious entity, and some of those religious entities and religious leaders are, and you may have already noticed in your own organization, have been relying on virtual technology, as I mentioned. Um, Other types of medical professionals have relied on telemedicine.
Hmm.
Religious leaders are likewise relying on technology, virtual technology, to facilitate the delivery of rites and rituals. I mean, delivery, like it's just like, I don't mean it to sound like it's just like, it is a worship experience. And so that's
Hmm.
one of the challenges. How do you move beyond the confines of a technological environment, a virtual environment, to create a sacred experience? But I have seen some incredible things with virtual services, just through the various religious entities, faith communities of faith, religious leaders drawing from virtual services, Zoom, using phones. Um, I mean, just going anyway, showing up anyway with protective gear, and fearlessly serving, um, with providing last rites. So, I mean, but things can still be done safely, and still be provided.
Hmm.
Resources, spiritual care can still be delivered safely. And but as providers, I think some of our responsibility again is to ensure that it's specific, just like any other spiritual care or any other type of intervention. Make sure it's sensitive to the needs and capacity of your population. And so when it comes to virtual, you're thinking about, at least I'm thinking about, and what I've observed is, how comfortable are people in using technology?
Yeah. Yeah.
Are they fearful of it? Are they concerned about Zoom bombing or a computer virus? So they don't want to download the software on their computer. Do they have even the equipment that's appropriate? I mean, do they have like a high-speed internet access? Do they even have like a modern computer
Yeah.
that can handle this? Do they have a phone? I mean, that like a smartphone would be ideal. I mean, not everyone has.
Yeah.
Commercials for the jitterbug, the
Yeah.
jitterbug phone, where you don't have. I mean, those are like very basic phones. I mean, you're not going to have a little image of a person on there.
Yeah.
So, but so those are that's part of making sure that we're being sensitive to our client population. Is,
Hmm.
do they have the capacity? Do they have the interest for that
Yeah.
technology to supplement?
Yeah.
And then if not, obviously, how do we make it safe, ensure that it's
Hmm.
safe? Any
Hmm.
kind of gatherings that are one-on-one, or other kinds of ways of social distancing, just having protective garb.
Yeah.
And then the
Yeah.
natural resources people have. I mean, they have natural resources. Maybe they have their own community of faith, faith community of folks that they want to have involved, and a minister that is involved in some capacity that you should be working with and collaborating with.
Hmm.
Lay people that you're collaborating with. On a personal level, it definitely hit home. A close friend entered into hospice
Mm.
care at the very beginning of this, so I was actually sick in the beginning of this. So I didn't want to visit, and I knew it wasn't right to visit because I didn't really quite know what was going on with me, at the time.
Hmm.
So we used technology. We used text messaging, and sent inspirational quotes and songs, and just checked in. And I think that's really one of the components of relational spirituality, and one of the therapeutic use of the relationship that anybody can engage in. You just have to be present. It's what was described, at least from a ministerial chaplaincy standpoint, ministry of presence. And we all have the capacity for that ministry of presence.
Yeah.
You don't have to have theological training. And so I was really, really, really sensitive and very concerned about her sense of isolation during this. So, and I really wanted to connect with her too, and be a resource for her. So that text messaging, the phone it was just phenomenal. I felt it had really helped me personally feel really close to her. So,
Mhm.
um, so anyway, I mean, that was just me operating as a friend, as a lay person.
Yeah. Yeah, you got some firsthand experience of the challenges and maybe some of the benefits of virtual technology. And it sounds like there's right now we're in a period where no one really knows the right way to do something. And so it feels like it is a safe time to try new things. Um, and it is the attempt and the intent that comes behind that um, that is really important. And I know through life we have different traditions and rituals um, as just part of everyday life and important times. And every year for an annual event, every year not you're not able to do the same thing every time. Sometimes there's a bad year and you're sick and in the hospital, or money's tight and you're not able to do something. But finding a way to still honor that tradition, to still do that in some way, is important. And I feel like that's kind of where we're at with this.
Absolutely. And again, the use of technology can facilitate that. I mean, the important rituals before and after death, those all, those can be facilitated with technology. It's not necessarily, like you say, going to be foolproof in terms of, we will have problems with connection sometime, sound quality and issues that it would be nice if we didn't have to deal with. But still, we make the best of this, and we, these are precious moments. I would not have missed, a moment of time with that woman. And
Yeah.
so, and even after spending time with her, sending her picture, talking with her, we had conversations that we probably would not have had face to face. We
Mm.
probably wouldn't have. So there was a sense of ease there that kind of virtual connection enabled. It was kind of weird, it was just
Yeah.
unexpected intimacy that virtual connection allowed for. And just the sharing of resources and pictures and music and stuff like that, probably would not have done face to face. So I'm really thankful for that, because she passed away.
Mm.
And I had no, no going back and doing that over. And even afterwards, feeling like, did I do enough? It
Yeah.
was, that lingering sense of, I should have just gone anyway, but at the same time, it's like, no, I made that decision out of love for her. I didn't
Yeah.
want, I didn't want to contribute to any suffering and bringing whatever I had to her. And so that's some of the, the follow-up, processing afterwards, that
Yeah.
some of the feelings of, did I do enough? The standard
Yeah.
type of issues that you're dealing with as a survivor.
Hmm.
So
Yeah. It's always easy to question what you did and maybe I should have done this or that. Um, and I always tell people, you do the best you can with the information you have at the time. And if it's coming from a place of love, like you're saying, I'm not going to see this person face to face because I love them and I want to protect them. Time. Is there anything else that maybe we've missed or not gone over?
yeah, one thing that you were talking a little bit about has to do with rituals, the importance of rituals, tradition. And so you have the natural flow of emotions that occur as you're going through this process, as whether you're working with a patient, whether you're a family member, you're a friend, or you're a provider, a care provider. There are many consistencies, and the emotions are still going to be there. The techniques of helping are still going to be there. Traditionally, we have only so many ways that we intervene. There's only so many ways that we can medically intervene, different. But at the same time, when we're adding the virtual component, it's still important to engage in um, virtual opportunities for closure. Because I guess what I was alluding to in that situation with my friend was, the risk for disenfranchised or ambiguous loss. The feelings
Hmm.
of, did I do enough? And you know, it, so processing some of that and ensuring that you have um, virtual access to maybe some type of a candlelight ceremony that you would have at your home. Um, so there are other types of maybe a funeral that is maybe with one or two other folks that's recorded and shared with loved ones. maybe it's just other types of the common activities that we do, like crying. I mean, even talking with other people, all the memory boxes, the containers, the scrap, um, creating a playlist of songs. So some of the same types of things, you allow you to process that grief and commemorate your loved one. And so all those things are going to be the same, regardless,
Hmm.
whether you're, but virtually still allowing for that connection, that community connection to celebrate the life of that loved one. And then also ongoing grief support. I mean, there's lots of on virtual support groups. I know at least one I've facilitated. It's a religiously oriented grief share group, and grief share is a group that you sponsored by a church initiative, which is they provide bereavement support materials, and usually this is facilitated by lay leaders in Christian churches. And so that group has been converted. Some of the groups have been converted online. And so, I mean, so there are still more opportunities to continue with that grieving process, and have the support that you need virtually, and just, adapting it to where
Yeah,
you can continue processing those emotions.
yeah, definitely. Yeah, I'm actually in the process of putting together an online support group for grief, and especially the COVID's impact on the grief process. So hopefully that'll be able to be a way to support our clients and our community.
Absolutely. Well, for sure. I mean, seriously, I've seen a lot of increased access to resources virtually. And that's just, again, talking about some of the strengths of this whole experience. That one of the positive things that's coming out of this experience, I hope, is just a movement more toward virtual resources, because that provides access, that
Yeah,
enables access, and provided too that folks have that comfort level with technology. So ensuring that folks are comfortable with it, they know how to use it, they have access to the resources to engage in virtual services or support groups, or whatever it is that we're offering. It's really phenomenal. I think this is an incredible opportunity to transform our profession as helpers by moving more online. It's just, I'm really thankful for that aspect of COVID-19. Again, I think that this experience has helped us come to appreciate the importance of community and finding ways to forge that community. And people have been so desperate for community that, they've really even risked their lives going out in mass.
yeah,
So that really, to me, speaks to the importance, again, going back to where we started, of relationships, and how relationships give us that sense of purpose and meaning, and that we need to find ways to cultivate those relationships that sustain us. And technology definitely is one of those strengths in my mind, from my perspective, that's coming out and providing us ways of continuing our spiritual well-being.
yeah. Well, I definitely did not expect us to talk so much about technology on the topic of spirituality, but it's turning into a great tool for this.
Yeah, I didn't
So
expect it either, to be honest with you. I mean, but to me, that's really has been one of the most profound game changers.
Mhm.
And I think that this is going to be, talking about a strengths perspective. I think that technology, ironically, is going to be one of the most enduring factors of this phase of our lives, that we're going to see a positive, one of the positive things that come out of this.
Yeah. Well, Dr. Callahan, I certainly appreciate you taking the time to talk with us today, and providing your insight and expertise on this topic.
Thank you so much. I wish you the best of luck in continuing your work.
Thank you. Bye.